Welcome back, everyone. Today we're diving into a recent research article, and it has the potential to change how we manage pain in horses, specifically oral morphine.
Yeah, it's really interesting. So we already know, like morphine, it's effective for pain relief in horses. But when we give it intravenously, we often see these, not so great side effects.
Yeah, like what kind of side effects?
The big ones are agitation and, those GI issues.
Makes sense.
So this research team, they wanted to see if giving the morphine orally could be the solution. Maybe it's the way to go.
Interesting. So it's not just as simple as switching from a needle to a pill, right?
Yeah.
This study, it looks like it really dug deep into the pharmacokinetics, how that drug moves through the horse's system.
Yeah, exactly. It's not just about the delivery method, right? It's about understanding the whole process, how the drug is absorbed, broken down, and eventually eliminated by the body.
And why is that so important, understanding all of that?
Because it all ties directly back to how effective and how safe a drug is. This study, they were really interested in those morphine metabolites, especially one called morphine 6-glucuronide. We usually just call it M6G.
Okay, N6G. Got it. So for those of us who maybe haven't looked at our pharmacology textbooks in a while, what exactly is M6G?
Basically, it's like a supercharged version of morphine when it comes to pain relief. It's way more potent.
Okay.
Yeah, the researchers, they think that getting those M6G levels up to a certain point, that's like the key to really tackling pain effectively.
So that's the why. Oral morphine maybe can get us the pain relief we need, but hopefully without those side effects we talked about. So how do they actually go about studying this?
All right, so they took 6 healthy thoroughbred horses.
Thoroughbreds. Pretty common breed for these kinds of studies, right?
Yeah, they're often used in research. Good temperament, pretty easy to find. And the study had 2 phases.
Okay, 2 phases.
With a 2-week break in between, a washout period, to make sure the results weren't being skewed.
Makes sense.
Yeah.
So what exactly happened in those phases?
So in the first phase, each horse, they got a single dose of morphine intravenously.
Okay.
And then in the second phase, they got multiple oral doses every 12 hours for about 4.5 days.
And that was so they could compare, right? See how the drug, acted differently depending on how they were giving it.
Exactly.
Now, I'm assuming they didn't just randomly pick how much morphine to give.
You're right. You got it. They were very specific. For the IV group, it was 0.2 milligrams per kilogram of body weight. And for the oral, 0.8 milligrams per kilogram.
And were those doses based on anything? Or
Oh, yeah. Those were carefully calculated. They based it on earlier research, all to hit those therapeutic levels of M6G we were talking about.
got to find that sweet spot. Enough to be effective, but not too much to cause problems.
Yeah.
So how'd they keep track of what was going on inside the horses? How could they tell if that oral morphine was working?
Well, they use a few different methods, actually. They took blood samples at specific times to check those drug concentrations.
Of course, yeah.
Really kept a close eye on the horse's behavior, looking for any bad reactions. And get this, they even did these thermal nociception tests.
Thermal nociception tests. That sounds kind of intense. What is that exactly?
It's actually really cool. Basically, it's a way to objectively figure out a horse's sensitivity to heat. So it's like looking into how well the morphine is actually blocking those pain signals.
Wow, fascinating. So we've got this well-designed study, specific dosages, a bunch of ways to measure the effects. What came out of it? Did the oral morphine work like they hoped?
Yeah, the results were really interesting. So they found that when they gave the horses morphine orally, it actually led to higher levels of those key metabolites, especially that M6G, compared to giving it IV.
Wow. So even though it's not going directly into the bloodstream, going oral actually meant more of the active pain relief stuff in their system?
Yeah.
It's pretty wild. But, I mean, more metabolites, that doesn't automatically mean better pain control, right? Like, how were the horses actually feeling?
You're right. You're right. That's the million-dollar question, right? And thankfully, the study actually gives us some pretty good answers. So they found that giving the morphine orally, it actually provided basically the same level of pain relief as the intravenous morphine.
Oh, wow.
Yeah. And they figured that out through those thermal nociception tests. Remember we talked about that?
Right. So same pain relief, but ideally without those potential downsides of having to go IV.
Yeah.
Okay, so what about side effects then? Did the oral morphine actually help with that?
This is where it gets super interesting, okay? So while they did see that the oral morphine, it did slow down the gut a little bit, especially right at the beginning, the overall impact on their GI system, it was way less than what they saw with the IV.
Oh,
And I remember all those behavioral observations they were doing?
right.
Way fewer cases of agitation or any other weird behavioral stuff in the horses getting the oral morphine.
Wow, that's got to be huge for vets, right?
Yeah.
Sounds like oral morphine could be like a win-win. You get the pain relief, but you dodge those nasty side effects. But, I mean, this is science, right? There's always got to be some kind of catch, right? Were there any hiccups along the way?
You know it. Never as straightforward as we want it to be.
Wait.
So it's important to remember there was one horse, right, in that oral morphine group, and he did end up with some mild colic.
Oh, no.
Yeah. It was short-lived, though, thankfully. He bounced back quick.
Okay.
But it does go to show, there's always the potential for something unexpected to happen. Any medication, there's always that risk.
Of course, every horse is different.
Mm-hmm.
Medications, they could affect them all kinds of ways. Just highlights how important it is to be super vigilant, keeping a close eye on them. Doesn't really matter how you're giving the medication.
Mm-hmm.
But even with that one horse, I mean, the overall results for this oral morphine, they seem pretty darn promising. What do you think?
Oh, for sure, for sure. I think it's a really good sign, like a step in the right direction for how we manage pain in these guys. But we got to remember, this study, it was kind of small, right?
Yeah, only 6 horses.
And they were all healthy, too. So we definitely need to do more research, bigger groups, more diverse, and ideally horses that are actually dealing with pain.
Absolutely, yeah. Like, this was healthy horses, so how does this actually play out in real-life situations where they're hurting, right?
Exactly, exactly. I mean, how does it stack up against pain from colic, laminitis, stuff like that, or even after surgery? That's what we really need to know.
Right. That's where it could really make a difference. Okay, so let's say, just for a second, that future research keeps backing up these findings. Where do you see oral morphine fitting in the grand scheme of things, for pain management in horses?
Oh, man, this just opens up so many doors. Like, imagine, right? Oral morphine becomes like the go-to, especially for those long-term pain situations, chronic stuff where you need relief that lasts. Think about it. Being able to give the medication at home, easy peasy, that would be a game changer.
Totally. Especially for those long-term cases,
Yeah.
like a horse with bad arthritis.
Yeah.
Right. They could get the pain relief they need without having to deal with all the stress of constantly poking them with needles and no risk of complications from the injections. That's amazing.
Exactly. And it's not even just about being practical, right? This study, it kind of shakes things up a bit. Like, we got to rethink how we've been using morphine in horses, and who knows? It might even lead to a whole bunch of new research into pain relief for these guys.
It's a good reminder that there's always something new to learn in veterinary medicine. We're always on the lookout for ways to take better care of our patients. Fascinating stuff. Any parting words for our listeners before we wrap up this deep dive?
I think it just goes to show you, it's always worth questioning what we think we know and looking for new possibilities. I mean, these findings, they have the potential to make a real difference in the lives of horses. That's pretty exciting stuff, wouldn't you say?
Oh, absolutely. This research really highlights just how much veterinary medicine is always changing.
Yeah.
It's exciting to think about, what kind of impact these findings could have down the line.
Oh, absolutely. I mean, think about it. This could be huge. We might start seeing completely new ways to manage pain in horses.
Yeah.
And who knows, maybe this could even spark breakthroughs in other species, too. It really makes you wonder.
This is a good reminder for everyone listening, veterinary medicine, it's always pushing forward. There's always something new to discover. Never stop questioning, never stop learning.
And that's what makes it so rewarding, right? We're always striving to improve animal health. This research really embodies that spirit of always searching for a better way.
A fantastic reminder for all of us.
For sure.
From Veterinary Jar, keep those minds inspired, hearts light, and tails wagging.